Hello everyone, my name is Na Chu. Currently, I'm working as a family nurse practitioner in an internal medicine clinic. This is my stakeholder education plan video for my Transformer Healthcare through Outcome Management class at Bremen University. The clinic was established by a successful physician who is from Sri Lanka. Our clinic locates a Spanish community and we serve Spanish population. The clinic has 3 providers. One is the medical doctor. The other 2 providers are physician assistant and a family nurse practitioner. The office manager is responsible for the daily and administrative activity at the office. The manager is also the timekeeper for all supporting staff, including 1 physician assistant, 5 medical assistants, and 1 nurse practitioner. 2 medical assistants are at the front desk, and they are responsible for answering phones, insurance verification, and checking the patients. Then the other 2 medical assistants are responsible for taking all patients' vital signs, gathering all patient brief complaints, and cleaning the exam room. The last medical assistant is the referral coordinator. The doctor, the physician assistant, and the nurse practitioner will be the one utilizing the new teaching protocol for patient education about pain management during 3 months of period. The medical assistant will be the one hands out of the survey during patient office visit. The survey is available in 2 versions, such as electronic version and the paper version. The medical assistant will be the one hands out the survey and help patient fill out the survey. All the collected data will be keyed into QuickTab survey website. The student will be used the QuickTab survey tools to have a weekly real-time feedback for the project status. After the 3 months period of student will collect all the data from QuickTab survey and reanalyze it with SPSS program. The final result will be published in a research paper by the student. Doctor, physician assistant, and nurse practitioner will be educated when and how to use the teaching protocol for the opioid use patients. For the project, only patients who are on opioids or who are considered to take opioid for their treatment are selected. The doctor, physician assistant, and nurse practitioner should use the pre-established teaching protocol pamphlets to educate the patient before prescribing opioids. All the possible side effects, contraindication, and drug interaction will be printed on the pamphlet. The main role of the provider is to identify the project sample population and use the protocol to educate them before prescribing opioids. Office manager and the referral coordinator will be educated regarding the way the survey will be handed to each opioid-taking patients. They will have a good understanding of the value of the project. The success of the project will be increased patient knowledge regarding opioid taking, and there will be reduced addiction and abuse opioids. All of this will add up the elderly to avoid misuse and abuse of opioids, which will increase quality of life for elderly. The student will develop the patient teaching protocol, and the pamphlets will the doctor, physician assistant, and the office manager. Medical assistant will be the one to handle patient survey during patient visits. They should be aware that multiple versions of the survey is available for patients with different needs. If patient has cell phone, they can download the app and do the survey on the phones. For patients who do not have cell phone, paper print version is available. Also, the survey is available in multiple languages and bigger print for patients with special needs. The medical assistant needs to able to verify the survey is complete and help them fill out the survey. due to the number of elderly taking opioids regularly are rising every day. The misuses and the abuse of opioids are also increasing dramatically. Rates of opioid prescribing and opioid-related overdosing deaths have quadrupled in the United States over the past 3 decades. The elderly are a prevalent population who take opioid for their chronic pain. However, some of the unexpected misuse and abuse can be life-threatening, such due to elderly's pre-existing conditions and past medical history. Elderly usually have memory and psychomotor abnormality due to opioid use. Therefore, risk of fall and hip fracture are risk factors due to prolonged use of opioids. Additional, opioid dosing can affect by hepatic metabolism and changing proportion of body fat and water. Since elderly have a slow metabolism, they will put them at high risk for addiction and overdose. To avoid this, the elderly use opioid to treat their chronic pain. This becomes very important and challenging to the provider. It is the provider's highest interest to eliminate the elderly to misuse and abuse of opioid, such as possible. Therefore, it is imperative for the healthcare provider to educate the patient on all possible adverse reaction and contraindication regarding opioid use before they take this kind of medication. This action may help the patient to avoid misuse and abuse of opioid, which will improve quality of life for elderly. Provider will use the teaching protocol for all patients going to take opioid for their pain management. During their office visit, the medical assistant will give them the survey and protocol about pain management. Each week, the student will analyze the data from the QuickType survey website to give feedback on the project status to all stakeholders. Any issue and improvement of the survey will be discussed during the analysis period. After 3 months of the data will be analyzed by SPSS program and published as the paper by the student. Also, I have my reference available to develop my presentation as below. So, this is my scaleholder education plan. If you have any question, I have a complete project will be ready.